Hello, welcome back. The topic today is hepatitis A virus. So it's a RNA virus affecting the liver. Most of us know about the hepatitis B and C. We have hepatitis A, hepatitis B, hepatitis C, D, E. So the hepatitis B and C, most of us know because it's very serious infection, and the government has made hepatitis B virus vaccination compulsory. So most of us know about the hepatitis B and even hepatitis C because it spreads like HIV. So we all know about the seriousness. But what is hepatitis A virus? Hepatitis A virus is also an RNA virus that affects the liver. How it spreads or how a person gets the hepatitis A virus? We can divide it into two categories. One is individual and the other one is community. Individual, it usually it's transmitted from the person who's already infected with hepatitis A virus. Suppose a family member has a hepatitis A virus, usually it can spread to the other family members by fecal-oral route. Fecal means the virus is excreted through the motion. Oral, so if the person has infected and he goes to toilet and suppose he doesn't clean or wash his hands with soap and water, so the virus will be in the hand, and if he touches the other person or we touch the other person or we touch the other person's, the infected person's dress and other things, they can go through the oral route and that can cause hepatitis A infection. So it's a fecal-oral route from the infected person. This is from the individual perspective. Community-wise, suppose the person goes, the infected person passes motion, the virus goes to the sewage. From the sewage, suppose there is, it contaminates the drinking water, and the drinking water is contaminated with hepatitis A virus, and the person, if the individual, if they don't boil the water, or if it's not treated well, if the contaminated water is not treated well, if it is not safe for drinking, or if you don't boil the water, then it goes in and it can affect the community. Even in some parts of the world, hepatitis A virus is endemic. It's always common there. It always remains there. So this is one part. So hepatitis A virus, once it enters, usually takes 2 to 4 weeks to show signs and symptoms. So the incubation period is 2 to 4 weeks. And what are the signs and symptoms? Usually they can get mild fever, malaise, body pain, tiredness, diarrhea, abdomen pain, and very important, the classical thing is jaundice. So unless the patient, the person, gets the jaundice, or if the urine is so yellow, they won't think about, they are infected with, or they have jaundice, or they are infected with hepatitis A, or for that matter anywhere. They don't go to the doctor. So once you get these symptoms, they go to the doctor. The doctor will ask the questions, examination, and suppose the it's clear, the eye is yellowish, urine is dark, loss of appetite, diarrhea, all these things. The doctor can think about viral infection, then he can ask for the blood test, and especially for hepatitis A, the immunoglobulin G, IgG positive for hepatitis A virus confirms the diagnosis. And very rarely, this disease goes into very serious morbid, a state where even death can happen, but 99.99% of the time, it's a self-limiting disease. What is that? Self-limiting means you don't have to do anything at all. Just take rest. Automatically the body heals itself. You don't have to treat them, no medicine, nothing. Just good hydration, good nutritious food, good rest. That itself, the disease will be cured completely. It may take maybe 10 days or even up to 20 days or 3 weeks, time. Automatically, if it is more than that, or you end up in liver failure, then the real treatment is needed. And usually it can affect young people or even old people for that matter. And when the children are affected, mostly it's very the infection or the problem is very simple, and it even sometimes go unnoticed. But adult can get this kind of problem, and during the treatment, probably it's better to avoid those medications that can affect the liver. The best example is paracetamol. So we can avoid paracetamol, especially people with hepatitis A virus infection and vomiting, diarrhea, jaundice. They can avoid paracetamol or any other drug that can affect the liver. So these are the only simple: rest, hydration, and avoiding drugs. These are the simple treatment, and it's self-limiting. And most of the people think, by giving some herbal concoction or herbal treatment or even sometimes the branding. You can go to see people putting branding. All these include no. They don't have anything at all. Even kilanali in term, has no effect on, or even certain tablets. However, the tablets they give for liver cleansing, or they can no. It's a self-limiting disease, and there is no need to give treatment, or there is no need of treatment at all. And usually, who are the main people can be affected? As I said, as an individuals, those who have old people, immunity, very low immunity, they can get affected. Or in the community, usually even school children. If suppose a school child or has this problem, and it can easily they can infect other children. Or in a community, as I said, through the contaminated drinking water that can spread to the community. And those people who have a abnormal sexual habit, or even who share the needles, the drug addicts, these are the people that are easily prone for these kind of infections. Okay, once you get the disease, it's self-limiting and it cures the body, completely recovers from that. And if once you get complete recover, you have a lifelong immunity. That is the good thing about the hepatitis-A virus, is they have a lifelong immunity, natural immunity. And those people, those who don't want to get this hepatitis-A virus infection, and those people who are immunocompromised, those people who have abnormal sexual activity or sharing needles, and if they don't want to get these things, hepatitis-A virus infection, they have the option of getting hepatitis-A vaccine. It's a wonderful vaccine. It's a safe, absolutely safe and complete 100% protection against hepatitis-A virus. Usually, it's given for people who travel. Certain countries have endemic hepatitis-A virus infection. So even the government itself is the travel advice to get a hepatitis-A vaccine. So it's a 2-dose vaccine. So day 1, then after 6 months, and you are lifelong completely protected. So hepatitis-A virus infection is a virus infection, and it's a self-limiting infection. There is no need to take any treatment. Just rest, good hydration, avoiding paracetamol, and clean hygiene. So suppose a person in the family is infected, the person they should wash their hands. After each time they use the toilet, they should wash it with soap and water. That is very, very important. And even for the community, we always say whenever somebody uses the toilet, wash their hands with soap and water. That itself will prevent the spread of hepatitis-A infection. And those who wants to go to travel to the endemic area, or those who are really prone for these hepatitis-A vaccine, infection, they can get the vaccination. 2 doses of vaccine can give them immunity. So this is about hepatitis-A infection. Thank you.